All right, everyone. Can y'all hear me okay? Yeah? Cool. Again, my name is Ivan Davila. I work with Central Health. Welcome, everyone. Thank you so much for coming. Just a really quick announcement. As you're hearing from our presenters today, there is a piece of paper taped on in front of you with a QR code. And Yesenia will also be passing index cards in case you'd like to write down something, a comment or a question via the index card. So you have two options to to give us your questions this evening, either via the index cards or through that QR code in front of you. And if you do that, then we will see your questions on the screen later on towards the end of the presentation. So feel free to think about questions and share them with us along the way. All right, and so I'm going to welcome my friend Lidia de la Garza. She is the Director of Student Family Community Engagement for Del Valle ISD, and she's gonna say a few words. Thank you, Lidia.
Hello, everyone. I wrote some notes. So I am Lidia de la Garza. I'm the Director of Student Family Community Engagement here for Del Valle ISD. This is my 4th year here in Del Valle. And it's a truly honor to have you guys here, and especially Central Health. They've made such a huge impact to our community here in Del Valle ISD. I work with our parent community liaisons, our displaced students, and I also work with our most at-risk students with attendance issues and whatnot. So I understand that having direct access for healthcare is super important for our community. Having our families go all the way into Austin to try to get into a doctor's appointment versus having somebody nearby where they can come in and out and go back to school and be ready for success, to be successful in school. So I really appreciate it and everything that Community Health has done. They're involved in a lot of our events with our parent community liaisons, always distributing resources, and I'm very excited for the continued partnership that we'll have here in Del Valle. Thank you.
And I'm gonna go ahead and give a warm welcome to one of our board managers, Ms. Cynthia Valadez, and she's gonna give us a few words and introduce our commissioner.
Thank you, Ivan. Gracias por estar aquí. I want to thank you all for being here. I want to thank one of my favorite people in the world, our commissioner, Margaret Gomez, and her staff for being here. Also, my dear friend and constable for Precinct 4, George Morales. Thank you, and your staff for being here. I want to thank you all as advocates and parents for the Del Valle area, because were it not for you and your advocacy, we would not be opening a clinic here in Del Valle. We finally took your words to heart after saying where are our tax dollars going? Why are we spending them on building a clinic in our neighborhood, in our area, so that we can attend? And I want to apologize for us taking so long to get here, but we're here now. And please let us know if there's anything that you want us to do, that we need to do, in order to make sure your needs are achieved. Anyway, I want to thank you all again. Gracias por estar aquí a todos ustedes. Y buenas noches. Por favor, si tienen algunas preguntas, avísanos. Y aquí estamos a servirles. Commissioner, if you don't mind, you want to take over this this woman has done everything possible to make sure you all had your clinic, to make sure Central Health will succeed, to make sure Sendero will succeed, because Sendero and Community Care are our partners in the enterprise system. Central Health is 3 entities. It's Central Health, it's Community Care, and it's Sendero, which is our only nonprofit insurance plan in all of Central Texas. So, por favor, apóyanos and pay attention to your commissioner. And if you have any questions, aquí está ella para contestar sus preguntas. Thank you.
Oh, okay.
Well, good evening, everyone, and thank you so much for being here today, this evening with us. I've been looking forward to this conversation for a good while, and I'm so glad that we are here finally today. And I like the expression of having a community conversation. It really is so much better than calling it a meeting. We don't have, we're not going to call anybody to order, and we're going to hear from every one of you. All of your voices are very important to Central Health, of course, but to me as well, because I've been looking forward to this clinic for a good while. And now that it's here, we really need to celebrate every single day. How about that? I guess I have to just, in an orderly way, say, I'm Margaret Gomez. I'm the County Commissioner for Precinct 4, and I've been here a long time. And one of the things that I found out was that in the early 70s, when I joined Travis County, there was a public health nurse out here. And there was a doctor who was kind of like a country doctor, Dr. Loika, and y'all probably knew of her. And then lately there was Dr. Morgan, also from the UT Nursing School. So that's what we had, at the very beginning. But we have promoted ourselves to being here now in this really beautiful clinic, which is going to deal with a lot of issues for each of you and your families and your children. At one time, there was a clinic out here, but it was just for school kids. That's who they treated. But now, the families of those children are going to be treated here too. And that's a very good advancement for our community. And let me make it very clear that your voice is very vital. We need to hear from you. Whatever questions you have, please be sure, don't keep it to yourself. It's part of good health to express your opinion. It's part of good health to ask a question, even if you think that it's uncomfortable for somebody. It shouldn't be uncomfortable for us. We should be able and willing to answer all of your questions in a very forward way. And unlike other people in this country, we won't lie to you. So, very importantly, since the legislation was passed, in order for us to deal with health in this county, and especially for people who cannot afford, going downtown to see a doctor, a special doctor, or anything like that addresses our health needs. It's important that we always, and I will always support Sendero, because at one time the county had the MAP program, and we invested money in that MAP program for many years. But Central Health, I'm glad, came along, and we transferred our MAP program over to Central Health. And it was for us to be able to cover the needs of poor people everywhere, indigents in this county. No one, whether they have the money or not, is going to get health care. And I'm going to make sure that that happens at all times. The other thing that has been made this a successful clinic is that the collaboration between Central Health and Travis County continues. And we have, I wish we could call ours conversations as well instead of meetings, so that we can sit across the table and exchange ideas and discuss why that might work, why that might not work. But, at least to be able to expand on the good things that are in place today. And it's all about serving our customer, serving our taxpayer who pays taxes in order for us to be able to deliver these services. So I'm very much aware of that. But the collaboration is really important where we can sit across the table and share ideas and not just point fingers at each other. And because the bottom line is there's the customer who is waiting to get the services that we can provide them. So we will continue, I promise you that I will continue to work hard with Central Health and come up with as many good ideas as we can to provide as many services as we can. So, so just remember, as far as I'm concerned, the customer is the reason we are here. The customer, the taxpayer, is why I'm here, and it's certainly why Central Health is here. So thank you all again for being here today. Please ask questions. Please send up your questions, and we will answer them as well as we can. Thank you again for being here.
Hola a todos, bienvenidos. Es un honor estar aquí con ustedes, and thank you so much, Commissioner Gomez, for hosting us tonight. Good evening, everybody. My name is Pat Lee. I'm the President and CEO of Central Health, and it is truly a privilege to be here tonight with all of you. As we get started, I just want to recognize a few friends and kind of just special guests tonight in the audience. Of course, Commissioner Gomez, guest number one, or we are guest number one. Thank you for hosting us. I believe the Del Valle Board of Trustees, Trustee Susanna Woody is here tonight. Thank you, Susanna. And Barbara, I'm sorry I do this, but our Community Care Board Director, Barbara Shirley, is here tonight. Thank you, Barbara. Manager Valadez from our board was here, opened us up tonight, and I'm not sure if Manager May, Elisa May, is with us, but I know if she's not, she'll be here shortly. So thank you, Constable Morales, George Morales. Not everybody has earned so much kudos and goodwill and good deeds in their lifetime to have a community health center named after them while they're still alive and can, actually go and do Zumba at their own center. So, Constable Morales, it's a privilege. I want to acknowledge my colleagues, Dr. Nick Yagoda, Interim CEO of Community Care, and Sharon Alvis, CEO of Sendero. Where are you, Sharon? Wonderful. Tonight marks the first time that we have had the privilege of having community conversation. I agree with you. Much better than a formal meeting. There are no minutes tonight, and there will be no Robert's Rules motions. We'll just listen to each other. Nothing against Robert's Rules, of course. But the first time that the CEOs of Community Care, Sendero, and Central Health have had the opportunity to stand up side by side with all of you to share with one voice and listen with, in this case, 6 years, and all of us here together. And so that is a real privilege, and I just want to thank my colleagues at Community Care and Sendero for your leadership and for all the work that took to be here together side by side. And thanks to all of you for being here to witness the very first of these. I think it's appropriate to be here in Precinct 4 for that. So I want to begin by just kind of reiterating what you all know about why we're here at Central Health. But our mission is to improve the health of our community by caring for those who need us most. We are here because we believe that a world-class city like we live in deserves a world-class health system for everyone, And we know that that is not the case today. There are gaps that we need to fill, and we are hard at work. We can't build Rome in a day, but with partners like all of you, we know that that is work that we are deeply committed to, and we're working actively toward, and we're going to share some exciting highlights for work we've done the past year, much more work to do. But I want to underline the point that you made, Commissioner Gomez, which is that your voice really matters. Central Health, as you know, in the past year began the direct practice of medicine. Now it's in the past 2 years where time is moving forward, but the reason it began the direct practice of medicine is because of your voice. We heard from you in these conversations and in multiple stakeholder meetings and in data gathered to validate the gaps, that there were significant gaps, moderate or severe gaps in every single specialty area that we looked at for our community. There was no area where there was ready access to the care that we needed. And so it was not working to only contract for that care, because fundamentally, I think the work that we do is hard. It doesn't make a lot of money. It needs to be something you believe in because it's right. And we do it in partnership with each other. And just constitutionally, we realized that together with our partners in community care and Sendero, we had to do this ourselves. And that's in direct response to your feedback. So your voice really matters a great deal. And so I hope that we'll get through our remarks without taking all of our time by any means, and we'll be able to engage in a meaningful conversation with you. There are aspects of, I've been here just over a year, aspects of insights that came forward in these conversations last year that made their way directly into services, such as a tight focus on food insecurity, in tandem with our healthcare services, knowing how important that is for so many of our patients who suffer from ongoing chronic diseases. That really initiated from a community conversation early last year, early in the budget process, and we lifted it up. So that's just one example of many, but I want to really encourage that dialogue. And remember, there's the QR codes right in front of you as just one of many ways that you can put those questions in. And of course, when we get to that point in the evening, we'll be passing this mic around and taking your questions live as well. So I would be remiss not to start a few slides I have with this one. This is a shot of some of our team celebrating. And I open every new employee orientation with this slide because nothing is more important than our people. I have the privilege of attending all of our new employee orientations, shaking the hands of every new employee, looking them in the eye, thanking them for what they do. And I have not encountered in my year so far a single new employee for whom this is just a job. It is a job. Thankfully, a well-paying job that is fair, right, and they do meaningful work, but every single person I meet is here for a reason, because this is something they believe is right. They want to do work that matters. They heard that others are doing this work. This is the real deal. This is what your values are. This is the place to do it. And when I say this, it's inclusive of community care, Sendero, community health. We are all Travis County Hospital District employees. We are all brothers and sisters in the same mission, and that is a distinct privilege. We've grown a lot in the past year. When I joined in January of last year, we had around 300 or so employees on the central health side. Today, we have about 700 employees on the central health side. That's more than 2x growth. And that always comes with its own opportunities and challenges. And I'm proud to share that it's my belief, and certainly I may not have this fully right, but it's my belief that if you ask our central health employees today, it still feels like the sense of family and the sense of mission that we had at 300 employees. And my hope is that, as we continue to grow, to meet the needs of our community, to actually build those bridges between the islands of care that have been separated by deep channels of water that patients have to swim on their own. As we build those bridges and grow, it'll still feel that way, right? It'll still feel that way. It's about family, it's about mission. We're called to this work. Many of us would even use that language, and we do it together. And so that's why this slide always leads. I'm really thrilled and inspired and proud of the fact that we can put our names up here together next to one symbol of who we are. Show of hands, who can see the C and the H and the plus sign in that logo? So kudos to all the folks who helped us develop this. But I love this. I love this symbol more and more, the more that it kind of sits with me. And I love the fact that all of us are on one team tonight. And I can't wait for you all to hear from Dr. Yagoda and Sharon Alvis later in the evening. But we are one, and we got that shared brand done last year. It's a process to get that on all the buildings and all the business cards and badges and so on. But we're well on our way. All right, in front of you, you have a one-page handout. called Key Achievements. I'm not going to touch on everything here, and I'm going to do it quickly, but you're more than welcome to ask follow-up questions. This is a brief summary of just a few of the things that we got done, largely on the central health side in this case for this page, but in many cases in close collaboration with our colleagues at Communicare and Sendero. So again, not every item, but just briefly, we expanded a lot of specialty care last year. 16 different specialty care and diagnostic service lines, things like cardiology, gastroenterology, pulmonology, nephrology, that's kidney care, stress testing, echo testing, ultrasound, x-ray, podiatry care, and so on. In some cases, we were able to bring wait times down from over 12 to 18 months down to a few weeks. And in some cases, sometimes you could get in and see a cardiologist tomorrow, right? In some cases at the New Rosa Zaragoza Clinic, and receive ultrasound in the only sort of 3D echo imaging machine. The most modern machine for that part of cardiology testing was in our Rosa Zaragoza Clinic in this past year. So not everybody knows all that, but that was a lot of work. These specialty service lines are new, and they're not as deep and robust as they will be as we're making them this year and in the future. But we laid down a lot of good topsoil, planted trees, right, that are going to be growing up. But there are patients being seen and have been for many months now in all of these areas now for over a year. I'm extremely grateful to our teams and proud of that work. We got more work to do, but it was a definitive step in the direction you all told us we needed to take. Here you see we opened the Rosa Zaragoza Specialty Clinic, and last month we opened the Del Valle Health Center, which you've heard about. I encourage you all to check it out, and we will have a grand opening soon to be, to be announced, and we encourage you all to attend. In terms of caring for those who need us most, there are 3 items here you're going to hear quite a bit about, so I'm not going to belabor the point right now, but the Bridge program, the medical respite program with mental health and addiction services, you'll hear about these in depth. I'm going to touch on the Housing for Health Partnership in a moment. I'm also extremely proud that we worked very carefully with some of our communities of color and our partners in those areas, Black Men's Health Clinic, the African American Youth Harvest Foundation, including a very important trauma resource center that they have developed there. Constable Morales and colleagues may be aware of this. There are individuals who experience a great deal of trauma who, after 12, 16 visits with counselors and so on, felt that they were able to come in and lay down their arms with no violence committed. That was so successful, the FBI actually came and recognized that work as a nation-leading work. And so just a little window there. Shout out to Michael Loft and his team. And the Hungry Hill Foundation, very proud and inspired by that team. And the reason why, not only is that the right thing to do, but we believe that healthcare begins with trust. Right? If we trust that the person caring for us actually has some sense of what we've come through, maybe they have lived experience, or the lived experience adjacent, and they spent the time, and they have our best interests at heart, and they're really showing up for us, and they show that to us, we're having a totally different conversation, right? When, my friend Barbara Shirley is ministering to folks, right, who are coming out of prison, coming out of the jail system, they're taking one look at you and seeing that first moment and saying, yeah, she's actually here for me, right? And that is a very different interaction for everything that comes behind that. And so that's why we're partnering with Black Men's Health Clinic and Youth Harvest Foundation, Hungry Hill. I could show up all day long, and I would never reach that place of trust, right? As Chase at Hungry Hill does from the moment he shows up, right, with the journey he's had. We have worked to establish a jail health program. This was at the invitation of our county commissioners. We worked very closely, with Sheriff Hernandez and her team. Got the privilege of touring the county jail and meeting with the health services, understanding what their needs were, listening carefully, and they said, look, take it slow, let's go together, let's build on success after success. We started with podiatry, foot care, right, which you may not have guessed out of the gate was number 1, but that was number 1 for them. And the very first patient who the deputies brought over, right? We had a separate entrance to make that easy and facilitated. They saw our podiatrist that had x-ray on site at the East Austin Clinic, and that first patient had a threatened limb. They were going to lose their limb, get amputated. We were able to immediately get them into care and save that person's foot. Just happened to be, right, the very first patient. And we've gone from there, expanded, I believe, into, Dr. Schultz, correct me if I'm wrong, cardiology, infectious disease, wound care, palliative care, which, by the way, is not about just dying, right? Palliative care is about you got a lot of complicated needs. You need someone to spend the time, really listen, and match that care to what you need. Whole person care for someone with complicated needs. That's palliative care. So really proud of that work. Together with the county commissioners and with Judge Brown's lead, and working with Integral Care, key partners that we love and work closely with, and with the Austin Police Department. We have been partnering to stand up a jail diversion program so that you can get the mental health care you need rather than be sort of cycling in the carceral system. So really excited about that work. Thank you, Commissioner Gomez and colleagues, for honoring us with a unanimous budget approval last year. That meant a lot to us, right? And to all the advocates tonight and who are not here with us who showed up to express their opinion and their voice, right? That they liked what they were seeing, wanted to see more of it. Please, endorse this budget. So thank you, all of you, for showing up. Your voice truly matters. We cannot stand without you. And when you show up and make clear that we are following your lead and we are doing what a community needs, that is the greatest place of strength that we can have. So appreciate that very much. All right, and the last thing I'll mention on the back page is a big shout out to Austin Community College, to the new chancellor there, Russell Lowry Hart. I love that man, as he loves our community to success. And we have launched together, I believe, 4 cohorts, Dr. Schultz, 4 cohorts of medical assistants, predominantly people from our community. So when you look at the Austin Community College, their typical student is a woman of color, single woman, mother of color, with 1.5 or so children, this is on average, right, who is working 2 to 3 part-time jobs. Right? Who knows somebody like that? Right? This is the typical student at Austin Community College. And these are the kinds of individuals, and what Russell Lowry Hart will say is those are the fortunate ones. Those are the ones who are able to enroll at ACC because they had the support and all the factors that allowed them. There are others who couldn't enroll, right? So those are the kinds of women, largely women, not all women, right? Largely women who are coming through our medical system program, getting that first stackable credential. And is it 17 or 19 who have joined our team, Dr. Schultz? Okay, so between 17 and 19 of those amazing medical assistants are now working in community care or central health. We are so proud of that, right? And they're contributing, and the economics are flowing back into our community. It's just good all the way around. So a huge shout out to ACC for joining us there. All right, by the numbers, and you have this on a different one-pager in front of you, I believe. A little over 155,000 patients, individual patients served in the past year by our combined system, with more than 150 million of your tax dollars spent directly on patient care, healthcare delivery. Our MAP program, which largely covers folks who are up to 100% of the poverty limit, is now over 50,000 patients. Manager Valdez, 52,046 patients through MAP. And our MAP Basic program, which extends beyond that, actually I believe with Manager Valdez's urging, thank you, is nearly 80,000 patients, up to about 200% of the federal poverty level. There are been a total of 612,964 primary care visits provided through our Central Health Primary Care Network, the vast majority of those at community care. You'll hear more from Dr. Yagoda momentarily. And then we are here in Precinct 4 today, as you all know. This comprises largely for us the areas that we look at together, South Central Austin and Southeast Austin. These are areas, as you know well, and we know through our demographic report, which is now available on our Central Health website, and I believe through some of these QR codes that you may have with you tonight. So just released, but we know that there are approximately 50 to 60% of the population living in these areas is Latino. Spanish is the first language spoken in those households, in between 36 and 44% of those households. And collectively, there are approximately 2,000 families living in poverty in these districts combined. Fortunately, there's a growing number of primary care clinic access points. We know wait times are longer than they should be, and we're going to work on those. That's a promise, Cavino and colleagues. But there's a list here. They range from sort of major multi-specialty sites like the Southeast Health and Wellness Center on Metropolis Drive, to Del Valle, to some school-based clinics and so on. You can see them all there. Central Health projects in progress. We've broken ground on the new headquarters of Central Health at the old Sears Hancock site. That will be both the largest clinical care site of primary care and specialty and diagnostic services side by side on the main ground floor. Also the headquarters for the system leadership of Central Health, Community Care, and Sendero together, and a very large community component where there will be many community events, and hopefully many of you and many of your neighbors and colleagues will come in for various events, see us at work, get their care there, centrally located, and a headquarters, importantly, that is actually not based in a hospital, because we know that health, community health, is largely centered in the community, not in the hospital per se, and it's important that our system headquarters is in the community and not in the hospital. Nothing wrong with having a headquarters in the hospital, but this is very intentional for us. We are launching our own medical respite center, hopefully this summer. I'm looking at our girl boss mogul, build it, get it done executive, Stephanie Leah McDonald. So hopefully this summer, hopefully about 50 beds at the old downtown Brackenridge campus where the old children's hospital was, with on-site clinical care and healing garden on that ground floor. So can't wait to do that and have you all see it. And then the rest I'm going to leave to my colleagues to give you more details. That's Precinct 4. Okay, this is my last slide. I'm just going to tee this up, and then we're going to hear a lot more from our medical teams. But this was a design slide, something between a hope and a wish and a prayer a year ago. And what you see on this slide is a journey that first starts. Imagine you are homeless, you have no home, and you're coming out of the hospital. Maybe you have a major wound from a surgery or an infection. Maybe you need chemotherapy for cancer. Maybe you need IV antibiotics for an infection in your heart. What do you do? Right? If we discharge you to the street, it's never going to work. So the first thing we started was respite, a place to heal. You'll hear more about that tonight. But we said, if you heal 6 weeks later, and then you go back to the street, what have we done? Right? What's going to happen? Most likely, you still won't have a place to live. You won't have the care that you need. You're going to get picked up for a misdemeanor, right? And maybe incarcerated, maybe incompetent to stand trial because you have a serious mental health condition that's not being treated. And then you're stuck for months or years. And most of those folks, by the way, are people of color. Right? Or you're going to cycle through the emergency department repeatedly until you die, actually. We know this from the recent data from the ECHO mortality report. You die 10 to 20 years, maybe 25 years before your natural time, before you should have passed, right? And some of that time is really, really miserable, right, as you're living these conditions. So not good enough, right? So we asked ourselves, what if we challenge ourselves to not let that person go? Once we've got you for those 6 weeks, and during those 6 weeks, we're getting you plugged in to your SOAR application, your housing application, getting your medications tuned up, getting the social work you need, starting that process of understanding what you need, what kind of housing you would need, getting those balls rolling. What if we never let you go for a year? A year is not even long enough necessarily for some people, but it sure is better than nothing. What would that mean? And we know from the national literature and from experience that if you put care and housing together without any interruptions, and if you work together as a whole community, as one, then that is the best practice. And if we get somebody stable on housing and care, it adds 10 years to their life. We know that from the national literature, we know that from the local literature, from ECHO. And so we set out to do that. But we know that on that road, there's a lot of things that we don't do in Central Health, right? That's a pass. That's a 45-yard pass with the receiver running in and just assuming things are going to happen. Folks are going to meet us in the middle. Food, transportation, housing, various financial support, disability support, more faith services, creative services, educational services, right? What does somebody need to have to get what they need to meet them where they are? What kind of ministry do they need to meet them where they are? So we didn't know if any of that was going to happen, and I'm delighted to share that a lot of that is now happening. And so without further ado, I want to hand over to our Chief Medical Officer, Dr. Alan Schulsha, our interim CEO and Chief Medical Officer of Community Care, Dr. Nick Yagoda, and Sharon Alvis. And so over to you, Alan.
Thank you. Thank you, Pat. Commissioner Gomez, thank you for having us. This is really exciting. It's wonderful to see old friends and to meet new friends. And I'm going to touch on respite. I'm going to touch on what we call the Bridge Clinic, and I'll explain why we call it the Bridge Clinic. And then I'm going to speak to various services that sit within some of our clinics. Then I'm going to hand it off to our real estate mogul, who will not only bat cleanup for me, but also touch on various facilities, and then Nick, all things community care, and hopefully we touch on many shared initiatives between community partners. Prior to two years ago, individuals who were unhoused, when they're discharged from skilled nursing facilities or from the hospital, let's say status post amputation or an exacerbation of heart failure, were discharged to the street. More than 50% of them rebounded and were readmitted. Right? So 2 years ago, Dr. Audrey Kwong started, by way of contracting, respite beds. Right? When we think of the respite environment, we're thinking about an environment to rest, recover, and heal. It is technically a non-clinical or a low acuity clinical environment. We started with 5 beds, and now we can flex up to 25 beds. This gentleman, middle-aged gentleman, Mr. Peavy, had multiple diagnoses, was hit by a car, had greater than 10 fractures, spent 2 months in the hospital, he spent 2 months in a skilled nursing facility, and then he spent 2 months within our respite environment. One of the things that respite allows is it not only allows us to connect people to medical services, but to the social services that they need so that they can then succeed, once they're out of that environment. He was our very first patient within the respite environment, and he's currently housed at Community First Village. One of the things we realized very quickly is that our respite patients were medically and socially complex, and we weren't able to care for them in that environment, or if we would, it was more similar or assimilated to what would be a skilled nursing environment. So we needed quick access to complex care and complex social services. We needed to be able to bridge them to care. Now, the design of our Bridge Clinic is really designed to be temporary, which is why it's bridging. I think Nick is going to touch on healthcare for the homeless and some of the CUC street teams. Our goal in our Bridge Clinic, and I'm going to talk about the 2 phases of Bridge Clinic, the 2 aspects of Bridge Clinic, is really to stabilize individuals and then get them back to their primary care home, which is why this system partnership is so important. We started out with phase 1 within our Bridge Clinic 1 day a week. And that was last September. So this is a pretty new environment that we established. By the end of the year, we're up to 2.5 days, and at the beginning of 25, we went to 5 days a week. We started caring for our own respite patients first, and then what we determined by talking to our EMS partners is that they receive about 6,500 calls a year for individuals who, if there was an opportunity to triage in real time, don't need to go to the ED. They could potentially be taken to a clinic that catered to individuals that had advanced clinical and social needs. And so our second phase of the Bridge Clinic was opening our doors to our EMS partners. 30% of the patients who now come to Bridge are brought via EMS. Now, when you step into a Bridge Clinic, and we've talked about fee-for-service many times, this is not a fee-for-service win, right? You cannot turn over patients every 20 minutes. A patient will enter, the team will ask what the patient's needs are. A lot of times they just want to soak their feet, right? We need to hear what their anxieties are before we start focusing on their clinical needs. If you go into the Bridge Clinic environment, they have a snack area, right? Because sometimes folks haven't eaten. All they want to do is to sit down and eat something, and then, once they're comfortable, we can actually find out what their clinical needs are. So that's what happened at Bridge. We also realized that while we could bring people into our environment, there was just as critical a need to go out into environments that potentially, moving forward, the CUC Street and Mobile team can serve. But we can act quickly, we can undergo discovery, we can either transition people into their medical home or temporarily into Bridge, or visit a few times until we figured out what the needs are, and then build it jointly again with community care. And so the second phase of our Bridge Clinic was born, and that is the Bridge Mobile Clinic. The first environment that we visited was the Women's 8th Street Shelter. Next was the Diversion Center. Again, thanks to the commissioners. These are folks with addiction disorders, and the partnership with Integral Care, where folks with that addiction disorder can stay for up to 90 days. Integral Care provides the mental health needs, and then Central Health provides the physical health needs. Again, upon discharge to community care, right? So this is a building environment in which there are still many gaps. This is a 21-year-old gentleman who was actually changing his tire. He was hit by a car, multiple lacerations, skin contusions, and had significant pain in one of his hips. He was obviously transported to the ED, stayed there for a few hours. Thank goodness nothing was broken. He was sutured, cleaned, and discharged kind of on over-the-counter meds. Called 911 a day to two later because of significant pain. They were able to triage, so we actually have a software that we triage in real time with EMS. It was decided that he was stable enough to bring him to Bridge Clinic. They brought him to Bridge Clinic, did an ultrasound, found out that he had a little bit of bleeding within kind of the hip joint, that nothing was fractured, but that increased bleeding was a hematoma, and it was putting pressure on a nerve, and that was the cause of the pain. So he was brought in. He was also found to have a secondary infection based on, kind of that, hitting the road and the top layer of skin being pulled off. And so they were able to put him on antibiotics. They were able to teach him how to clean his own wounds. And he was discharged on stronger pain meds, right? And so the other thing that happens with these folks is once they enter our environment, our team wraps their arms around these patients, and they are our patients until they are comfortable moving on to CUC. And CUC does a very similar thing once they're in their environment, but we're just able to cater to their specific needs. He then came in a while later. We removed his sutures. He then came in a while later, and they transitioned him to physical therapy, behavioral health. He had already experienced trauma based on his background, but then was, hit by a car, and then to ophthalmology for, some visual acuity concerns, right? And then to his PCP over at community care. The Bridge Mobile Clinic is mobile, right? So from establishing a map card and signing folks up if they are eligible but have not been signed up, to conducting a visit on site, to conducting labs on site, we will go to the patient, right? This is also the team that goes to Hungry Hill. So we bring all our toys and we leave with all our toys. I'm now very briefly going to touch on 3 of our clinics, and I really want to, so the Capitol Plaza Clinic is the clinic where Bridge is housed out of. It is also one of the clinics where we offer specialty care, and you can see some of the specialties that, that work out of this clinic. Community care provides kind of this wrapped, holistic, Suboxone access for individuals who have addiction disorders. Many individuals that come to our Bridge Clinic also have an addiction disorder, and so again, this is why this partnership and our system has to work together, because patients advance and patients succeed when we do so. And this partnership within the Capitol Plaza Clinic, where the other specialties are housed, whether it's case management or dietitians or pharmacists or the specialties that are cited here, our patients succeed when we work together and when we build like this. Our East Austin Clinic, community care actually initiated podiatry, through joint collaboration with Central Health, and that was a few years ago. When we expanded podiatry, we actually did so at the East Clinic, and one of the advantages we had is learning from the environment that was established within community care. Anytime we set up a clinical environment, our goal is to offer a one-stop shop, right? And so for individuals who have a podiatric need, which means from the tibial tuberosity or down, right below the knee and down, right? If we can conduct weight-bearing x-ray, which sounds strange, it's a very simple machine, but not offered many places in Austin. If we were to ask a patient to transition from the clinic, get the image done, and then come back, chances are we don't see that patient again. So anytime we have access to our patients and we can do a definitive diagnostic that really leads us to what the treatment and the improvement plan may be for the patient, we need to do that then and there. We also have ABI and TBI. I think Pat alluded to the fact that for our justice-involved individuals, the very first individual who came into this environment had vascular compromise, right? So if it's like a river, you block the river, whatever is downstream is not going to grow. And so because we have some of these diagnostics, we're actually able to use those diagnostics and get the patient to the care that he deserved. And then obviously we wrap every one of our environments with case management, dietitian, pharmacy, and behavioral health. A new service that just started, actually I think we did our first surgical case, what's today, Thursday? Tuesday. We have general surgery now at the East Clinic as well. So this is a service that I think our patients have really been advocating for. We think there is a great opportunity to get individuals into surgery much faster than they have been in the past, and not waiting till kind of an end of system failure to get them into care. Rosewood Zaragoza, we offer these specialties as cited on the slide. I did want to touch on palliative care. I think Pat really started to speak to palliative care. When people hear palliative care, a lot of times they affiliate palliative care with hospice, right? And it is not. I think our patients have so many complex social needs and so many complex physical needs that what palliative care is it's a coach, it's a counselor, it's a resource. And so again, it allows us to wrap our arms around our patients. And I'll give an example. I think we have 134 individuals who entered our dialysis program, so are no longer getting emergent dialysis. But an individual with end-stage renal disease, that is a complex disease. Those folks, anybody that receives dialysis should have a palliative care consult and should be on board with our palliative care team. We can explain to them what the disease process is. We can help link them to services. We can provide them with counseling. and we can get them into the care that they so surely deserve. And with that, I'm going to hand it off to the real estate mogul.
Thank you, Dr. Shalsha, and I want to acknowledge that Manager May is here, as well as Manager Motwani from the Central Health Board of Managers. Manager Motwani chairs the Infrastructure Committee, and that is kind of our term for all things that are invested in our capital program. And Leonore is walking out the door, and before she leaves, I want everyone to acknowledge Leonore, because we are going to have a host of wellness programs at the Del Valle Health and Wellness Center, including Zumba. Come on, Customer Morales, you can come and teach. Yoga and other things, so look out for Leonore, and she'll be connecting with many of you. Good luck. It is an honor to do the work that I get to do at Central Health, and I want to acknowledge that everyone on my team, whether they're on the health and wellness operations side or they're part of the capital program delivery, we believe fundamentally that everyone in the world, but especially here in Travis County, should have access to quality health care. And I think we make good on that. And here at Del Valle Health and Wellness Center, it is evident. We couldn't have done it without the community. We would not be here without the Del Valle ISD folks. So thank you so much, Trustee Woody, Trustee Newberger. We, over the course of many years, I remember meeting with the Community Advisory Committee during the pandemic. I don't know if you remember any of these Zoom calls, Trustee Woody, but we would talk, and you do. And it has been a community effort, and I'm going to look to Senora Segovia. Thank you so much for keeping the faith. We really appreciate you and your commitment to making this happen. So we softly opened. It took us a little bit more time than we were hoping, but we have over 18,000 square feet down the road, Elroy and Ross. It is now open for patients. We've got a really great team of 3 primary care providers there. We also have pediatric and adult dental available that will be ramping up over the course of the next few weeks. I was there the other day, and a poor little boy was having his tooth removed, so I don't think he was very happy with me that we had made this accessible to him. But we do have also a full pharmacy. It has a drive-through. We've learned something. We've learned that a lot of the people in the Del Valle community drive trucks. So next time we'll, raise the drive-through window. But it is open to everybody. If you are a patient, you're a patient in another primary care location across town, and you want to have your doctor call in that prescription to the community care pharmacy over there because it's close to you and you can drive through, we would welcome that, right? And then also, I don't want to forget, we've got a great team. Monica kind of slipped out, but Monica Rodriguez is there. She is a community health worker. She's there to connect people and help them navigate to the right coverage program. She can get you an appointment with one of our community partners, see if you're eligible for CHIP or for Medicaid, SNAP assistance, for food assistance. And then one of the things that we're really very happy to be able to provide to the community is Austin Diaper Bank assistance. So we have diapers, other products available when we can, adult diapers that are available to the community. You do not have to be a patient. You can send anybody there, and we can connect them with the resources that we have available. We are so happy to have we have a community room there, so we're happy to have other community partners meet there. And it's been a real added, I think, benefit to the community. We've seen a lot of utilization at our Hornsby Bend Clinic and the community room. This room is also programmed for some of our wellness activities, and as the Health and Wellness Center ramps up, we'll make sure we advertise. We have a monthly calendar, and we'll get that calendar out to you with all the services and activities that are available. We hope to have, not that anybody wants to remember this, but we do have tax preparation assistance available at a couple of our sites, and we'll try to continue those services as well. There are other services that are really important to the community, and I know we have met frequently and have heard some of the other things that are available both at our site, but also to Travis County. And I would be remiss, Commissioner Gomez, if we didn't thank the county for allowing community care to provide clinical services at the employee health clinic. It was only on a limited basis, but I think it helped us bridge the gap until we were able to open. And I look forward to mark your calendars. We're thinking August 9th. We know it'll be hot, but we have some space inside to have an official grand opening event once we can get everything online. And thank you. I think, we think about all the work that we have done in this community, and a lot of it has been with your support. And I'm just thinking right now about all the time we spend at the Circuit of the Americas. And thank you so much. Thanks. We currently have 3 providers at the Del Valle Health and Wellness Center, and I say we because they are part of our team, but they are really dedicated family health doctors and practitioners from community care. And the other day, I had the privilege of listening to Dr. Waterman, who is a provider, a family health doctor, who has been a part of this area and part of the community for a number of years now, both at Hornsby Bend, at the Del Valle Employee Health Center, and now here. And she got very emotional, and she told me, and I hope nobody rats out the AMA or whoever cares about this, but she got very emotional, and she said, we're taught in medical school not to show emotion. But she said, this site means so much to my patients and to our community. And she really cited the fact that people do drive several hours sometimes to get to their healthcare appointment if they're coming, east to west, north to south. And she said it is something remarkable to have a comprehensive health center, a primary care medical home right by their home. And so I cannot thank you enough, and all the taxpayers of Travis County who are committed to making sure that we have a safety net healthcare system that meets the needs, but is also a quality health home. And I can't say more about our partners at Community Care than the fact that they're committed, they put their money where their mouth is, and we are so glad that they are in and operating at the Del Valle Health and Wellness Center. And with that, it is my privilege to turn it over to Dr. Yagoda.
Thank you, Stephanie. Thank you for the invitation, Commissioner Gomez. And to everyone, my name is Nick Yagoda. I am the interim CEO at Community Care. I'm a family physician. I'm a New Yorker, so I'm just going to lay it out. I've been here 10 years, though. And I stay here these 10 years for many reasons, not the least of which is the extraordinary opportunity that this region of the country actually has. So I am a health center person, health center man. And when I say that, I mean that I did my training rather late in my career growth in medical school, but I knew right away that I wanted to go into primary care and specifically wanted to do work in federally qualified health centers. And for those who are not super familiar with it, that is, there are many benefits to what this program offers. Most importantly, we are accountable to the patients, directly accountable to the patients we serve. The majority of our board members are patients of the health center. And it creates because of that commitment we make to serve anyone, regardless of their ability to pay, and that we are led and are accountable to our patients, it creates a different type of healthcare, one that is more holistic, one that generates more fair outcomes. And if you were to match that with what is also extraordinary about this region, and that is that we have a hospital district designed specifically to care for those who need it most. And the combination of both the hospital district's capacity, and thank you to all the taxpayers who continue to make that possible, to Pat's comments earlier, who year over year help us reach for more ambitious goals. The marriage of the health center program, where we are accountable to our patients, and this hospital district with such a commitment for the taxpayers means that we can deliver a level of integration and a level of focus on those who need care most that is rather extraordinary and in some ways can outdo what is done in those states that have expanded Medicaid or have historically deeper institutions for social supports. So I think it's important to tip our hat to what the extraordinary moment is that we have here. We are a large health center, one of probably the top 15 or 20 in size in the country. It is a joint health center between community care and central health. We served over 143,000 unique people last year, and year over year over year, that number grows. It was a 7% growth over the prior year. That translated to over 500,000 visits. That is a lot of care. It is also a lot of employment. It is also a lot of advocacy. This is a large engine that we have here, and we are grateful for the challenges you have given us to continue to strive to close the gaps that we know persist and that we are committed to closing. We're grateful for your support all along. Oh. I want to also reflect that it takes a lot of years, a lot of time to build healthcare right. And I'm grateful for how everyone within this system has leaned in. We heard a great deal from Alan before about the Bridge program. And this Bridge program has its deep roots in what has been a commitment at the county level, at the city level, at the clinic level, to serve those in the most extraordinary circumstances. We have a large healthcare program for those who are unhoused. That includes almost 5,200 visits. That is in similar models to what Dr. Shalsha described. We may be out on the street visiting patients. We may be going to camps. We may be visiting in our regular primary care offices because some people are in and out of housing stability, but they have a stable relationship with their primary care doctor at a particular clinic. So to, I believe, some comments that were made earlier, we meet our patients where they are. And we find ways to be as adaptable as we can, whether it is in a traditional four-walled clinic or outside the four walls. The most important is to understand the needs of our patients and ensure we are going to them. To that light, in that light, as substantial economic development has happened in and around Travis County, the dynamics of where our patients are have shifted a great deal, and we respond in a similar way. Understanding the needs of our patients and going to them to fulfill those needs is core to us, which I think it's important to reflect on meetings like this. So again, thank you for welcoming us here. Being accountable to our patients, being able to sit here and have conversation. I know we've talked at you a great deal here, and it's important that we're able to show how far we've come because of your support, but we do very much look forward to the conversation we can have because we know there are gaps still. We know we have a ways to go, but we're very committed to ensuring that this is an ongoing conversation, very dynamic, so that we are responding to the right influences. So thank you for the time. I believe I am handing it off to, Sharon. It's a tricky clicker.
Thank you so much.
Down is forward.
Down is forward. Thank you very much for that, Nick. First, I'd like to thank all of you for welcoming us here and for being here to help support Central Health and the initiatives that we have, and to thank you to Commissioner Gomez for helping us with this. Your support for Central Health is really important to us in what we're trying to do. So we really do appreciate the community all being here. So from my perspective, what you've been hearing from Central Health and from CUC is these individuals, these groups, these organizations provide health care. We try and figure out how to pay for it. So that's what Sendero Health Plan is. We are a licensed HMO, licensed in Texas, and we, in fact, by the way, I will brag on us, we're the only 4-star rated health plan in the entire state of Texas. For 4 years running, I will add. So we have a unique relationship with Central Health, and it's really special because Central Health identifies among their population the sickest of the sick. And those patients end up over within Sendero, and we take care of these patients who otherwise might not be able to get the intense level of care. I'm talking transplants, I'm talking patients, I'm talking CAR T-cell therapy, I'm talking procedures that cost millions of dollars. In fact, right now, we call this program the CHAP expansion program, and right now we have 900 members on that. How do I move this? Down is up? Manage that for me, would you please, Kim? Down is forward. Down. There we go. So right now we have 900, we have actually 29,000, almost 30,000 members within Sendero's health plan, which is an open plan on the open market. We sell to a whole lot of people, but in that allows us to serve what is now 911 CHAP expansion members. And within that group, we currently have 88 members who are potentially scheduled for a transplant. They're in the process, they're on the list, they're being considered. We're looking at whether or not they can be brought into the whole program, and they're Sendero members, and we are doing everything we can to get that care for them and be able to adequately pay for them. And that way, that helps Central Health, and it helps the Travis County residents in taking care of a population that would not ever likely be able to access those kinds of services. So I'll share one story. We have a member who is 38 years of age, has been on dialysis for 3 years, which is pretty young to be on dialysis at 38 years of age. And in January, he was a new MAP member from last year, and we were a MAP expansion member, and we were able to have a kidney transplant. And we spoke to him in March. He is doing fabulous. He is so grateful that he doesn't have to look at having dialysis 3 times a week for the rest of his life. And that's the kind of programs that we're able to, in collaboration with Central Health. And it's complicated, how we manage it and how we work it is aspects of the Affordable Care Act, but it really is a program that we are really grateful for the collaboration with Central Health and with CUC. And there is truly a new world that's evolving within Central Health, and that this group is coming together. And we are looking at ways of how do we better support each other? How do we do things that are better for the taxpayers of Travis County, because we are providing service in a more efficient ways. We are looking at ways to collaborate across the enterprise. And so I, for one, am delightful to be part of this program, and thank Dr. Lee and Nick for their support in all of this. And Dr. Where you are, Soshler, he's over there in the corner. So thank you all, and thank you all for allowing us to be here. So.
Good evening, everybody. My name is Kim Heinonen, and my role at Central Health is to promote innovation and performance improvement. And one of the areas that we're focusing on is care delivery, how to improve access and to improve health outcomes. And we're looking for inspiration, for guidance from a very, very unlikely source. We're learning from Toyota how to manage, how to design work, how to design processes. And of course, you're asking yourself, what does Toyota have to do with healthcare? So let's watch a brief video, and it's called The Toyota Effect at UCLA Medical Center in California. And hopefully we can get the video to play.
My name is Liseth Urias, and I have been a diabetic for 15 years, from the age of 17. I wasn't able to afford medication, so I stopped using it for about 5 years. My eyesight goes blurry and I see flashing lights throughout the edges. I did not know that diabetes would cause this type of damage to my eye. It would be nice to be able to see my family, my surroundings, especially my nieces and nephews. I'm sorry. I lose my energy a lot. Focusing through one eye, it drains me. So I feel like I'm not there for them as much. It's hard on me. I try to be the stronger one.
Liseth is a great example of our patient population. She's young and she didn't have access to care. We are a county-owned facility and our mission is to serve the underserved. She came in with diabetes that was out of control, high blood pressure. In addition, she was bleeding into her eye.
We had a surgical wait list that was hundreds of patients long, and to not be able to intervene in a timely fashion, and is really, really difficult to deal with. Liseth and patients like Liseth would have to wait for months for surgery, and in the process were going blind.
Toyota was contacted by the Harvard UCLA Medical Center, and when I heard that many patients were going blind waiting to get service, I actually couldn't believe it. How can that happen in the United States?
People ask all the time, what on earth do making cars have to do with hospitals and healthcare? Hospitals and health systems are looking to the Toyota production system to improve, and we reached out to them. We really didn't know what was wrong. Sometimes when you work in chaos, you don't know how to get out of it. So what Toyota did for us is they helped us learn to see our own environment. And so we did observations. We stood in the clinic and watched the process flow.
We just had a table with all the charts lined up, one big mountain full of papers. Doctors were frustrated, nurses were frustrated. So with the color-coded system, now we know red is laser. Bam, here's your patient. It's so much easier for everyone.
Physicians were spending more time in the hallway than they were in the clinic. And the reason why is that they didn't have the supplies they needed close by. Now that sounds like a very simple solution, and it turned out to be. We asked them, what do you need at the clinic side?
Part of Toyota's message is that this is our hospital. They're not going to be here to tell us how to do things. They're going to come here and teach us how we can identify ways to make ourselves better.
It's changing our culture. It's transforming us as an organization. We're not the same organization we were a year ago. We're taking some of the lessons that we learned from the eye clinic and are spreading the change throughout the hospital.
Go and open both eyes for me, is that? Great. You did really, really well. Over the past 2 years, we've taken a surgical backlog that was hundreds of patients long, and we've eliminated it.
It's 5 o'clock, and all the patients have been seen.
This is the best project I have ever had. At work, we only do work. Here, we actually help people.
I never would have thought that implementing the Toyota production system would help save lives or keep people from going blind, but it has.
Can you make out how many fingers I'm holding up?
It looks like one.
Very good. And here?
2.
Very good. Can you see the screen?
Looks like an F.
Very good.
She was blind, at least in her left eye, she was blind. And what the surgery means is that she's going to have good vision for the remainder of her life, and she has many, many years ahead of her.
being able to see my family. I think that's the most important thing for me.
So one of the key takeaways from that video was that, the people doing the work learn to improve their own work. And we're going to do the same here at Central Health. A typical care delivery process looks like the visual at the top. The letters represent departments or specialties. If you want to access any of those departments, there's a long wait list. So you might have to wait for weeks to get in. And imagine if you have to, travel through the entire journey, touch every department in that process. It might take you months. But the actual time you get care can be summed up in hours. So that process is very, very inefficient. At the bottom, you see a process that is way, way better. So it's almost like an ideal process. And Dr. Schalza, we don't have to look too far. Dr. Schalza talked about this. This is the bridge clinic. No appointment needed. You walk in, no waiting room. You get access to urgent care, some specialty care, substance abuse, ancillary services, medications, and basically you're in and out without delays. And imagine a day when our entire system of care was not fragmented and siloed, where it doesn't take you months to go through the process. Instead, it's fully integrated, end-to-end, from primary care to post-acute care. Your care is coordinated, well managed. There's no delays. You flow through the system really fast. Thank you.
All right, thank you, Kim. All right, everyone. ¿Ya tienen preguntas? Does anybody have a question? Before we get to your question, ma'am, there was somebody who we've been getting questions via the system that I mentioned earlier. So one of the questions that we got was if there have been discussions about expanding mass transit to increase access to care to the Del Valle Clinic. I know we have a partnership with Cap Metro, but do you care to talk more about it?
Depending on the question, we have a lot of different folks in the audience or in the room who might have expertise, so we'll just kind of flow up and respond together. So this one was taken by our girl boss mogul, Get It Built executive, Stephanie McDonald.
Thank you, I think, Dr. Lee. So I do want to know that we acknowledge that there are transportation challenges, especially in eastern Travis County. We are very aware that there is not the right service, potentially, especially with the growing number of families in this community and this quadrant of Travis County. We have been meeting with Cap Metro, and we understand some of the limitations. We did the pickup service ride recently in Colony Park, and understand that that may be something that may be an option in the future. I'm really short, Yvonne Davila. Thank you. So those are things that we know, and we will advocate. And if there are opportunities, to work with the court in ways that they expand service, we would be happy to be part of that conversation. The other portion is that we do have a robust transportation service for patients. If you do let us know, that we will try to help you where we can. It's a ride share. Potentially we even use taxis still. So if that is something that we can do to help someone get to their appointment or to get home from an appointment, those are resources that are available.
So in short, yes. Can we get to the next question, Sarah? All right, how is community care planning to do outreach in the community for their new Del Valle Health and Wellness Center? I can speak a little bit to that and then turn it over to Tara. Oh, go ahead, Dr. Yoga.
No, please.
Okay, so in partnership with Community Care, Central Health, the Central Health Marketing and Communications Department is working on a very robust campaign, starting with paid media, which that's gonna start with, actually Community Care already started running some paid media, and then ours is gonna run in early May. We also have a grand opening coming up. We've been sharing flyers via grassroots to community partners, etc. Go ahead, Tara.
Hello, my name's Tara Trower. I'm Chief Strategy Officer at Community Care. The communications and outreach teams work with me. Anytime we open a new clinical site, we do multiple layers of outreach. We know that there's a lot of need across the area, and as I think Dr. Schulsha mentioned, that we have some folks driving a very, very long way to get to care. And so first and foremost, we reach out to our current patient population who may be driving long distances to get to care, even though they live in the Del Valle area, to let them know that they have additional choices. As Yvonne mentioned, we've been doing some paid media, we've been doing social media. We have a ton of partnerships with other community providers who work with folks to also let them know that there are new options around. We also will be collaborating with them on the grand opening event, which we're really excited about. And we'll continue the campaign to let folks know that there are additional choices for care that may be closer to where they work, live, or go to school. And our wonderful outreach team, and where did Carla go? I know are doing a number of events specifically with Del Valle ISD. To also help spread the word with our teams where we can do financial screening as well as make appointments and really try to make it as easy as possible for folks to access the services here in Del Valle.
Hold on a second.
I don't need it. I appreciate all the words, but one of the things that's interesting to me and I think to the people here is what's most important. Call for a ride, put the number. I appreciate you saying all these words and call and we're gonna get a campaign going and blah, blah, blah. But I think if we have a very simple message, call for a ride, es this number, you know, si necesitas transportación, llama este número. Put it out there, everywhere. I think it's straight and to the point.
Thank you, Manager Valadez. Everything that we produce, both Community Care and Central Health, is in Spanish and English, and we'll be working with our partners at Telemundo and Univision also to get all the message out there. Manager Valadez. Go ahead, Sarah.
DPRIT was just announced, the Dementia Prevention Institute for Texas. I'm wondering how you guys are going to implement it, or whether you guys are going to secure funding for programs. I mean, I'm glad that you guys are getting the healthcare together, but as our population ages, we have other health needs that are going to be impacting and straining the healthcare system.
Great question. For those who are not familiar, the DPRIT acronym stands for the Dementia Research Institute of Texas. A cousin to the already existing Cancer Research Institute of Texas, Cancer Prevention Research Institute, of which we are a participant. We have actually spent a good portion of the last 12 months developing a wellness program for those suffering with dementia. This new added opportunity is very exciting to us. So we hope to be able to take advantage of it, particularly through our multi-layered partnerships. But these, particularly at a time when how we fund healthcare is gathering a lot of attention, these types of innovative avenues are very helpful for us. So it's close on our radar.
Great question. The only thing I wanted to add, and I actually want to step even one layer up, is between Community Care, Central Health, Intro Care, and Dell Medical School, we're working together on the mental health care continuum. and who should be playing in what spot so that we don't duplicate unnecessary services and we really curtail resources and we care for folks that right now are falling through those care gaps. So dementia is one of those areas that we've still got quite a bit of work to do on.
Thank you, Dr. Yagoda. Next question on the screen. Who qualifies for respite care? Can public services refer individuals to it?
It's another great question, and one of the things that I can't believe I didn't mention is right now we've contracted, for about 25 respite beds, but this summer, Monica's looking at me like, you should have mentioned that. But this summer, we're opening a facility with 50 respite beds, which is in our own environment, and that's the old clinical education building, the old Children's Hospital on 15th Street and I-35 again. Thank you, commissioners, for the support and the taxpayers. But what we're going to do is we're going to increase the number of beds, so we're going to go from about 25 to 30 to 80. And the goal here is that, the longer we hold on to folks, the greater the chance of of connecting them, with resources. And it takes about 4 months to gain housing for individuals. And so the smaller number of beds we have and the more rapid the turnover, the less chance of actually avoiding kind of this cycle. As of now, to actually answer the question, as of now, we take referrals from hospital partners, from skilled nursing partners, from EMS, from any clinic system. We're limited, right? We only have about 25 beds, so there's much more critical need. So we need to continue to expand.
All right. I wanted to actually, are we ready to talk a little bit about the Cameron Road Center, Dr. Shasha, and how that's going to help expand our medical respite?
I hear Monica's voice in my head. You should have talked about Cameron Road. So Cameron Road Monica, please wave. Monica's our Chief Strategy and Risk Officer. So Cameron Road is the next iteration. We're going to get the CEC up and running, and then Stephanie and Stephanie's team is really helping us with the lessons we learn within the CEC. Cameron Road is 3 buildings. So we can offer clinical care, we can offer addiction services with the expertise that sit, within community care, and we can really cater to, our unhoused population. We're considering skilled nursing. We're considering a lot of things for that campus in order to try to really make it a campus and again, stop that cycle. But that's a year and a half away, maybe 2 years away. And anything you want to add to that?
Sure, I just want to, it's a good question. I want to build on it. Actually, this is just the right height for me. And I want to channel a question that Commissioner Howard asked me when we visited the Bridge Clinic. And when she saw all these services put together that just, you can come and have a snack, you can soak your feet, you can have a nap, then you can get your MAP card and your primary care and your specialty care, and so on, all in one stop with no waiting in between. She said, how are you paying for this? Right? And first, Dr. Kwan got the question. She helpfully threw it over to me. And so I said, well, the first thing is that we understand that our bottom line is not our own income statement. And we are a special purpose taxing district. Our bottom line is the community's bottom line. Right? The community pays for the police force, EMS, the jail system, city, county, housing services. The community also doesn't receive the benefit of the economic productivity when people are too sick to work or miss that opportunity to be healthy, or businesses can't hire because the cost of benefits has gone up too fast, or, very importantly, people die before their time. Right? Human life has value. It just does. It also has economic value in terms of the productivity and the vitality of our community. If we have a vital Travis County, Austin, for everybody wins and benefits. So that's the first thing. We see that as our bottom line. And against that problem, right, what happens in the Bridge Clinic if we don't do what we did? If we let somebody go on what my friend David Gray at the city calls the carousel of death. You're chronically homeless, you go in the ED, they kick you out. You're chronically homeless, you get picked up for a misdemeanor, they put you in jail, they kick you out, right? You go on this carousel until you die, 10, 20 years earlier. Well, if we think about the value of life in economic terms, health economists will say that every year of life is worth about $50,000 to $90,000, right? There's a range. You know, if you want to talk about whether life has value, I'm happy to have that conversation all day long, right? I don't think that's a partisan issue. It's not, it's just a human issue. Human life has value. We know from ECHO that if somebody has been chronically unhoused, has the benefit of stable housing and care, that adds 10 years to their life. Now, I was an English major in college, but 10 times 50,000 is $500,000. I can promise you that getting somebody a snack, a place to sleep, you know, soak their feet, and so on costs a lot less than $500,000 a year, right? And so that is what we're doing when we extend that care continuum beyond respite. When we stand up our own respite, when we work with our partners at CUC, when we work, we just came from a meeting with Alan Graham, right, and the Mobile Loaves and Fishes team. When we work at this level and we ask for the trust of our community and we channel these taxpayer dollars upstream to get people the care, the mental health care, the addictions care, the social care, the spiritual care, and the housing they need, we are generating enormous economic value for the community. That's how we pay for the care. And so when we are at Cameron Road, we know that this work is many hands, right? Many hands make light work. That's sort of Haitian metaphor, right? We want to figure out a way where all the folks who are doing this work together can come alongside an individual person, minister to them, care for them, break down all the barriers. We're not all going to work for the same agency or institution. Our paychecks can come from different places. You know, benefit, who cares, right? Let's focus on a person before us and meet them where they are, deliver whole person care to the most vulnerable. And so that's the broader vision at Cameron. What does that need? What does that look like? What's that place? There's 3 buildings and a large parking lot in between those buildings. It's a place. It's a future campus. It's a canvas for us together to envision what that looks like. And I don't think that's been built before. Right? This is the place where we can do that. When we think about what pulls us together, you know, frankly, what has pulled Community Care, Central Health, and Dare together to be here together, it is that vision that here in Travis County, here in Central Texas, with your support and trust, we can try to do things that have not been done that really matter, right, for the right reasons. And so I just want to offer that up and sort of a statement of hope and belief, what we're here to do. Thank you.
Thank you, Pat. I'm going to go ahead and go to the question on the screen. How does Central Health support families who already have health insurance? Do you offer any other services or programs that complement or enhance their existing coverage? Perhaps, Dr. Yagoda, you can answer some of the, based on what Community Care offers.
Sure. So at Community Care, as I mentioned before, we see any patient regardless of their ability to pay. That does include folks who do carry insurance. You've seen one insurance, you've seen one insurance. And the coverage of all necessary services is not always there. So we do have the capacity working with our partners at Central Health to ensure certain additional services are covered. And of course, we also offer, for those who need it, a sliding fee scale. So there are services, but I will be fully transparent that our focus is largely on those who do not have insurance, though we do care for all.
Thank you, Dr. Yagoda. All right, Charles Jr. the third.
Yvonne, I just want to check. We have a number of team members in the room. Anybody want to add anything that we might, you know, Nick and I are aware of certain things at the CEO level, but there's a lot of things we don't know. So, Stephanie, you want to come and add?
It's just that our services at the Wellness Center are open to the community.
Okay. So the Wellness Center is open to all.
And then the services that you think may be missing or that need to be added, we can talk to Sendero about including that in their plan. for possible services, if you please enroll in Sendero. Okay.
Add to that?
Please.
That was my question. And I asked that because we are a healthcare desert, and that's really the only options we have in these areas. And if it's limited services because they do have some insurance, it really isn't effective to our community.
Yeah, so there are no barrier. There should be no barriers based on your insurance. In fact, there are advantages to having it all housed in one location, particularly having a pharmacy in the same place that you can get your teeth cleaned, that you can get your healthcare needs addressed. So there are no barriers to those who have insurance.
Yeah, I don't think that's widely known, so thank you for clarifying that.
And, that brings me up to a related point, which is that we would love to work with you all to figure out how to get the word out, right? If Commissioner Gomez or your team puts the word out, people listen. Councilor Morales, if you put the word out, people listen. And there's others in the room similarly. So there are many of us in the room that work on outreach and communications and want to connect. So if there are key messages that we want to get out, maybe we can think about for Precinct 4, what's that look like? So we have a really effective way to make sure people know what rights and access and care is right at their fingertips. So.
Actually, we will be doing some canvassing to promote the grand opening of the Del Valle Health and Wellness Center. And it's okay. Door-to-door healthcare.
Thank you. So I'm really interested in the Bridge Mobile Street Clinic, mainly because I know with the unhoused population, getting them their MAP cards back, which allows them access to the clinic, is a pretty hard barrier to get through, especially when you're having to wait through your mailing system or what have you, or go to a particular location to get your MAP card. So that's a twofold question. My first question is, have you guys thought about implementing AI? I don't know how it works with HIPAA to speed up the application process, one. And then secondly, have you guys thought about with that Bridge Clinic, because I think what I heard is that the Bridge Clinic brings basically a mobile clinic to your location, but are they able to get that MAP card same day with that?
I'm happy to take a first swing, and if I miss anything, please jump in. So AI, yes. We're thinking about AI for eligibility. We're thinking about AI for a range of problems. In fact, I will share actually, Sharon, you want to share this story, and then I'll build on it?
Sendero had the fortunate or unfortunate circumstances that we had planned for about 15 to 20,000 new members effective January 1st, 2025, and we ended up with 30,000. So needless to say, we were blown away by the ability to respond to that many. We had sent everybody's ID cards out in December, but it was during the Christmas holidays, and people didn't get them in their emails, and we emailed them out. And of course, it's complicated because once you get in, you can't automatically print a card. You've got to load them in a system. The system's got to be set up. I mean, it's not like throw a switch. What we ended up doing back on AI though was after the first 15 days of January, we had so many calls coming in, and we were unable to manage them. People were very angry with us, and we brought on AI. We brought on an assistant to take our calls, an AI assistant, and within 24 hours, it was handling 89% of our calls. And so it was amazing, and by the end of January, we were fully caught up and back to normal. And we brought on staff, trust me, we did everything we possibly could to build up, but you can't get that many staff on in that time frame. And we can't predict because we do not know how our rates are going to compare to our competitors until they hit the streets. And if your rates are really competitive, then you're going to have higher volumes, and it's difficult to control and be prepared for it. But AI was a lifesaver. In the meantime, we also have an AI consultant working with us now, and we are working on looking at the letters that we have to put out to providers and members when we do prior authorizations as part of the health plan. We're not having them do they're not looking at anything clinical. They're just going, you got a letter that needs to go out, it needs to go, here's how it's going to be generated and printed and put out the door, faxed out the door. So we're working on AI to do that right now. And we hope to have it ready in, I don't know, Karen, there was a call, Karen Ader is Karen Ader is here, she's my chief strategy officer. And there was a meeting today, right? With AI on progress on that. So we're hoping within the next couple of weeks to have that in place. So yes, we are all very definitely looking at AI, but carefully, with consideration for the implications. There's also a lot of things in the legislature right now about AI, and so we're watching that very carefully along with it. So something Central Health is right behind us. You know, the Chief Technology Officer with Central Health is very involved in this initiative, and we're all looking at how do we make this better by using a tool like AI. So.
May I ask a question about Sendero? I've always been interested in Sendero because, you know, that's kind of what I look for, so to make sure that people in the community who need it the most, you know, will get the care that they want. How many folks are registered now in Sendero?
29,453, I think.
I knew Sendero could do that. I just knew it. And so it was not satisfactory for me to hear that there was too much risk in signing up people for Sendero. Well, golly, you know, if that's the business we're in, that's what we need to take care of. But congratulations for signing up many more people, and just keep on signing them, please.
Well, thank you very much. We're going to do our best.
We have another question here from Mr. Gavino.
Could I just build for a moment? 1 second. I want to brag on Sendero a little further. 2 years ago, Commissioner Gomez was 6,000. So that's a huge growth, right? And to my understanding, those 89% of calls answered by the AI call assistant, actually people are very satisfied. It doesn't feel like I'm getting a robot here. They're very satisfied. I will add that for us in this community, in this room, I want to propose that we can think of the A in AI as standing for access, and the I for standing for inclusion. Yes, I said that word. Access and inclusion. Because that's what it does, right? When you think about that slide that Kim Heinen put up, all those delays, a lot of times those delays are because there's processes that need humans to touch it and pick up the phone and move the paper, and they're repeatable processes that the AI, I think, I may get this wrong, but I think the AI call assistant that we have can answer 1 million calls in a fraction of a second. We haven't even used 1 second worth of AI capacity this year, right? In all the work we've done, it's that much better, and patients are satisfied. So my commitment, our commitment, is not to let our community wait last in line to receive the benefits of what's coming. We want to do it safely. Patient experience, dignity is so important, but the AI can translate in real time for many things accurately. It doesn't get tired. It acts 24/7. Right? It can allow your doctor to face you and not treat the keyboard, and the room listens and documents. You get more time, you know, with your doctor face-to-face, which we know is so important, and so on and so forth. So, you know, never waste a good crisis. Sendero had to reach for this. It was like a life and death thing. And then we saw, oh my goodness, right? So we are lining up an AI strategy. We've done a needs assessment, a readiness assessment. And then hopefully we're going to have a few tight use cases like this, probably in eligibility, probably in prior authorizations, maybe in a lot of these areas that it can just do it better and faster with the human in the loop just checking all is well, right? To just briefly answer your other questions, Bridge does map access same day, right? Sometimes you walk in 3 hours later, you've got your map card. So just to answer that question.
That in addition to the Bridge team, there's also the ability to get it same day in the emergency room with our street teams. a whole variety of other settings in our clinic at the Arch. And so there is the ability to do that, as well as virtual screening, so people don't have to come in anymore. And you can be at home where all of your documents are. And so we are very actively looking at ways, we're waiting for the AI strategy to come into play to make it easier for folks to get the information they need so they can get the health care that they need.
Thank you for your patience.
I come here to speak about boots on the ground experience, okay? And I wish that some of y'all would be at the front desk when one lady comes in 5 minutes late to her appointment and be told, you cannot be seen, you have to wait 3 more months. She literally left crying, okay? The other one, today, it is unacceptable to have someone go to your centers and say, the earliest we can see you is in September. I took a young man to get an eye exam. Well, he got offered a job at the Austin Lighthouse. They told him, go get an eye exam and a physical. Well, they told him, well, we don't do eye exams here. I said, well, what about a physical? Oh, yeah, we can see you in September. And I'm saying, wait a minute. Now, with Senderos this year, because of that increase, there were people that were left out without services for the first 3 weeks. I had a young man that I was working with that wanted to go to rehab, Rehab called me and said, Gavino, we called Senderos. Man, we were on the phone 5 hours. The following day, we were on the phone 2 hours, and they hung up on us. And I said, well, here's this man that wants to, he wants to go. At the end of the day, when we did get, there was misconfusion out of pocket. We thought it was covered. No, it's not covered. So our organization raised $1,700 so this young man could get access to drug rehab, substance rehab. And by the time he went, 3 days, he says, come pick me up. I don't want to be here no more. So yeah, it's great that you increased it, but during that increase, there were a lot of people that were left out, that were shut out. Okay, and the one thing, and we have the former Travis County auditor here, and she knows the value of money. Let me tell you, for the first day in January, you got 29,000 premiums in your pocket. Okay, so that's why as a customer, you say, well, what happened? And yes, the Central Health District, you're a far cry from meeting the needs of our people. A far cry. You're not even close. So I think that it's important that, I don't know, AI or whatever he was calling it, you put into place into reducing the time you'd be seen by a doctor. And not only that, when you are seen and you go, I've gone to, because I've got an appointment, you don't see a doctor no more. You wait 3 weeks. Well, it was to follow up, and well, there's something else that happened. I want to see, oh, well, you're not going to see a doctor. And I said, well, wait a minute. So I hate to bust y'all's bubble, and all the padding that now, I've been listening to. But boots on the ground, I don't know, maybe they don't know all about this. And those programs, unique programs you have, there's an issue to it. Oh, we only have 10 beds. I said, oh my God. So, you mislead people. And I think you have to do a more basic door-to-door campaign, in vulnerable communities. That's the reach out, that I feel that needs to be done in order to be accountable for the monies you're receiving, okay? Because you're getting quite a bit, even through Medicare, when they enroll in your programs, you receive money for that service. It's not free. Someone says, no, it's free. No, it's not free. Someone is paying for it. But anyway, I just want to echo that. And again, this is like maybe 2 years after that you still have to wait 6 months to see a doctor. And that's unacceptable. I'm sorry. I hate to bust y'all's bubble, but, y'all are far cry in meeting that criteria.
Thank you, Mr. Gavino.
Gavino, I just want to say briefly, you're right. We got a lot of work to do. I'll build on your point here. In our recent demographic report, when you look at the care that people are getting, think of that as the tip of the iceberg, right? The ice above the water. And we're glad, right? There's more of that ice now. There's more folks getting care than there were. But we also look at the iceberg under the water, right? There's some places like in diabetes where we have the amount of knowledge of who has diabetes in the community that we would expect, given the rates of diabetes in other areas. And then there's things like cancer, where at least in the MAP and MAP basic population, I'm being transparent and open, we're seeing 30% of the cancer that we would expect to see. Human beings in Travis County have DNA, like human beings outside Travis County, there's cancer here. We're just not finding 70% of it. And that's a call to action, just like your comments are a call to action. Please know, we know that we are far from the world-class health system for everybody that we need. That's where we're going, but we got work to do. I'm gonna let Dr. Hugo to speak to the primary care access point, and maybe Sharon speak to the Sendero point.
Thanks for being so forthright. As I was saying before, probably the most important part of these evenings are that we have conversation about hard things. We have all been through hard challenges, and frankly, amongst all of us, this has been a very challenging year. And we're not afraid to confront those, and we appreciate people holding the light up to the sore spots. We know our access is deeply dissatisfying to us, to our patients, and for all the stories that we share that are very positive, there are an equal number that perhaps are not so positive. And I hope it doesn't come across that we are satisfied with the level of service that we've provided thus far. We have a lot of ambition, and the fact that we are accountable directly to our patients, that on a monthly basis, community care goes before its patient-led board and asks how we're doing. And so that we are continuously being held to the level of performance that our community deserves, which is not what they're getting right now. That doesn't mean that all of this work can't be viewed as a sign of hope that we are making steady progress, but I don't want that to be confused that we've reached the promised land. By no means have we.
I hear your pain. I do. Because no one was more upset about the fact that we were unable to take calls and handle patients than myself and my entire team. There is something unique in Sendero. The staff there is all very, very compassionate. And they were working nights trying to follow up on the emails because you could leave an email for the phone call. And we did everything we could to try and manage it. And as I say, if it wouldn't have been for the AI assistant that came in and helped us, we would have drowned. And it really literally did take over those. But in the meantime, we actually had an email set up where if it was urgent, you could direct it to us urgently. If it was a clinical issue, if you were trying to get a medication, if you were trying to get in a facility, your provider, if they had to have prior auth, they also should have been able to have sent us a fax requesting an admission to that facility. And so sometimes I think that healthcare is so complicated, and I don't think we designed it to be that way. I don't think anybody in their right mind would have designed what we currently live with the reimbursement and the methodology and how it all works. But we all kind of have to live with it. And my team was very upset. We were having daily meetings, and the staff that was trying to answer the phones, and of course people were angry with us. They were putting names on, someone posted my personal home address and my name, and they said, if you want to go complain to the CEO, here's her home, here's where she lives, let's go have a powwow there in her front yard. So we were very upset about it. And had I known, and I frequently, on several occasions, when people came directly to me, they came to me through LinkedIn, they got directly to my email address, and I called and spoke to several of the members to try and to solve them. If I'd have known about your issue, I would have gotten you with our utilization management, our clinical team, because they would have stepped in and tried to help you. So my apologies to you sincerely for not having done a better job. We don't have a 4-star rating with that kind of service. So that's not who we are.
I appreciate you acknowledging that.
No, it was a mess.
And my last comment is that I go to Monterrey and families go to the clinic, to the doctor. They're seeing that. And I say, What is it that why is it that we can't do that, you know? So maybe that's something that y'all need to research, look into their structure. Yeah, how is it that you can see a patient in 1 or 2 days and we have to see them in 6 months? But thank you, and I appreciate
And again,
the work.
I'd echo what these two gentlemen have said. We really do appreciate the feedback. As I tell my staff, if I don't know what the problem is, if nobody's identified it for us, if we haven't heard, we can't fix it. And this, you've put a big challenge in front of us, because trying to get the scheduling with that many patients and that limited resources, and it's hard to do for Dr. Nagoda, and so his team. But anyway, it's really difficult. So thank you so much.
Thank you all. Okay, so we are at time, everyone. It is actually past 7:30, but if we are okay with answering the one question on the screen, then that's the last question we'll answer. Okay? The question is, does the Del Valle Pharmacy offer discounted medications, or is it comparable to other options in the area? And then what is an incentive to use the Del Valle Pharmacy? And then a Sendero question, does Sendero offer discounted health plans? So we have two questions on the screen.
I'll take the pharmacy side. There are a wide array of discounts available to patients depending on what their insurance status is. I will not bore you with all the details of what each of those looks like, but our goal is to minimize any cost for our patients for medicines that they need.
Sendero, as a licensed HMO, is very heavily regulated by the Texas Department of Insurance and also by CMS, and we have a specific series of products that are all part of the Affordable Care Act and available on exchange, and some of them with the CHAP expansion are off exchange. So there's nothing over and above that, but there's a whole series, and you can qualify for the tax credits, particularly if you look at the silver plan when you go on the ACA. Does that answer the question?
I think so. Thank you all so much. Well, let's give a round of applause to our speakers and presenters. A couple of things, y'all. Okay.
Is there only one question left? Because if there's only one question left, then it might be fair to just ask it so all of the questions on the QA are asked.
All right. I think is that fair? We have one more question. We have one more question. Okay. One more question. What is Central Health strategy in expanding its employment of health professionals, paraprofessionals, namely peer specialists, family partners, and community health workers? Thank you.
Another excellent question. Workforce development is, it's critical to our success. And Nick may want to speak to this as well. I think what we have learned is when we actually represent the communities that we care for in the clinic, we are much more likely to be successful. Pat spoke of the MA cohorts that we are running with Austin Community College. We are also in the process of kicking off a community health worker cohort. This year, we hope to get our first cohort in. It may be close to the end of the year. The cohort will be 10 individuals. What we've been able to do with our MAs is actually, I think, recruit between 90 and 95% of the MAs from the communities that we serve. And that is the same goal with the community health workers. So this year, if we're up and running, hopefully, we've been certified by the state to actually certify those community health workers. We hope to graduate 10 between community care and central health. I think we have something like 43 community health workers that work within our current environment. We need a ton more. Peer support individuals, just as important. We are hiring now. We are continuing to hire. There is a lot of evidence that points towards the fact when individuals have addiction diagnoses, when they've suffered trauma, those individuals who are sitting within our respite environment, the key to success is really having peer support, individuals who have lived experience helping our current patients then walk through the process. So it is a significant part of our plan and our workforce development. Anything you want to add?
Nothing substantial to add, other than that peer support specialists have been a core part of our addiction medicine program. Community health workers have also been core to our population health strategies, and recognizing that traditional healthcare is built around a relationship with a doctor. We should all be very clear, and I'm speaking as a doctor, I know there are a number of doctors up here. Doctors are not the most important people in the healthcare system. Oftentimes it is, please don't take offense, oftentimes it is the people who you can just develop the strongest relationship with, and peer support specialists, community health workers have proven to be some of the strongest relationship bonds that hold the promise for enduring, continuous, comprehensive care.
Just for the record, Sendero also engages community health workers. I think we have about 10 on our staff right now, and we're growing that population as well. So I want to hear about your program, guys. When you Thank you.
All right, everyone, just two things before you head out. One, there's another QR code in front of you, and that is to give us your feedback about this particular event. And number two, just thank you so very much for coming. Thank you for being here with us this evening, and for asking all your questions and also listening to all the answers. So please stay engaged. Give us your feedback, and there are multiple ways that you can continue to stay engaged here on these forums. Thank you all so very much. Have a good night.